On Monday, Angelina Jolie stunned the world with the revelation that she had a double mastectomy in an op-ed article for the New York Times. Since then, it spurred an important discussion about health care for women. Here to break that down, and all that you need to know is health and wellness reporter Zalana Momany. Hi, Z.
Hi, Matt. Yeah, Angelina has bravely shown us how important it is to be informed about our health. So today we're going to talk about the genetic mutation that she brought into the spotlight and preventative steps you can take.
So a lot of questions have come up now, which is a good thing, people asking questions. Tell us about the mutation and what that actually means.
All right, so Angelina revealed in the New York Times that she has a BRCA1 genetic mutation. Now, I know that sounds technical, so let's break it down. BRCA stands for breast cancer. The BR is from breast, the beginning of the breast word, and CA, cancer. So BRCA genes help us fight cancer in the body, but some families do have broken or mutated genes that are passed down through generations. Now, approximately 5 to 10% of all breast cancers and 14% of ovarian cancers occur from this BRCA1 or BRCA2 genetic mutation that's passed down from either parent.
And that was the case with Angelina.
Right.
Her mom had breast cancer.
Right.
She died of ovarian cancer.
Right.
And then her maternal grandmother also was diagnosed with ovarian cancer.
Right, exactly. So women carrying this genetic mutation have up to an 87% chance of getting breast cancer through a lifetime and a 54% chance of ovarian cancer, which is very high. And to put it into perspective, in the general population, 12% of women are at risk for breast cancer, which is about 1 in every 7 to 8 women in this country, and less than 1% for ovarian cancer. So this type of hereditary breast cancer generally targets younger women. So opting for preventative surgery like Angelina did by, removing both breasts can greatly reduce the risk.
So then what would prompt someone to get tested?
Good question. Testing is recommended for people who have a family history of the genetic mutation or of breast or ovarian cancer. So you definitely, want to ask your doctor if testing is right for you. It's a pricey test, but if you have this type of history, insurance companies will cover it.
Now, are all breast cancers caused by this type of mutation?
That's another great question. There's actually 10 genes that can cause breast cancer, but this gene that Angelina is dealing with is the most common.
Okay, it sounds like there's a small percentage of women that are affected
Right.
by the actual mutation, but if you don't carry that gene, are you still at risk?
Every woman is at risk for breast cancer, and our risk increases as we age, but lifestyle changes have been shown to reduce risk even in high-risk women. So it's never too early to start.
Okay, and what are some preventative things that people can actually do?
Right, so the Mayo Clinic recommends several things you can do. Being overweight is linked to breast cancer. Fat cells actually release a small amount of estrogen, so you definitely want to try to maintain a healthy weight through diet and exercise. Now, the American Cancer Society recommends 45 to 60 minutes 5 times a week of exercise, so you definitely want to try to stick with that. Smoking is something else that has been caused a risk factor, and younger women tend to have that more prevalent for them. The other thing that is really important is the more alcohol you drink, the higher your risk. So you definitely want to try to limit your drinks to one a day if you are going to drink alcohol.
And you really can't stress enough to do the self-exams at home.
Absolutely. You really need to be vigilant and thorough for detection. If you notice any changes in your breast, any new lumps, any skin discolorations, talk to your doctor. And ask your doctor when to begin screenings or mammograms. Under the Affordable Care Act, women's preventative health, like mammograms and health care, like prenatal care, cervical cancer screenings, will be covered by insurance with no deductible and no co-pays. So definitely something we should take advantage of.
Such great news.
Exactly.
Right there.
Exactly.
And what other resources are there for people out there?
Well, the National Cancer Institute and the American Cancer Society has comprehensive lists of risk factors, is a great resource, tons of information on there. And just remember, if you do have a risk factor, it doesn't mean that you're going to get breast cancer, right? So definitely, making these lifestyle changes will reduce your risk, and you'll just feel better overall.
And now we're hearing that Angelina Jolie will, in fact, remove her ovaries.
Correct, yeah. People magazine just reported that she will be removing her ovaries to reduce her ovarian cancer risk.
Well, she certainly achieved her goal.
Absolutely.
And has everybody talking and people asking questions, which
Yes.
is the best thing in this situation.
Absolutely.
All right, thanks so much.
Matt.